Good morning, I'm Jack Berryman, the ACSM historian, and we're here this morning talking with Jim Sallis. Welcome, Jim.
Thank you.
As part of ACSM's Distinguished Leaders in Sports Medicine and Exercise Science DVD series. So Jim, just wanted to start off a little bit of your early years, where you grew up and went to high school, and did you do sports in high school maybe and things like that?
Yeah, I grew up in Jackson, Mississippi, and suburban area, and went to a really good high school, but I was not involved in sports at all at the school, but my whole childhood was playing sports and games, in the neighborhood.
Sure.
The way things
Street
happened. Street games, the way things happened in the 60s,
I understand, yeah.
So I got a lot of activity, all informal, little bit of, baseball, Little League and that sort of thing, but mostly just informal sports and activity.
And so you stayed there through high school?
Yeah, through high school. I went to a very small college there in Jackson. It's called Belhaven College, now university, and majored in business and psychology. And
where's that?
It's in Jackson, Mississippi.
Oh, it is?
Yep.
Oh, you didn't go far.
No.
Okay.
No. My primary mission at the time was to play a lot of rock and roll music.
Oh, neat. What did you play?
Play drums, and that was just my passion, and I still do it.
I'll be darned.
Yeah.
So the Beatles were big then, right?
Yeah. I would have to say, like probably many other people, watched the Beatles on TV.
Ed
1964,
Sullivan
Ed Sullivan, and said, I want to do that.
Yeah. I watched the same show, but I knew I wasn't going to be able to do that. But I appreciated it.
Yeah.
So what were the years you were in college, your undergrad years?
Let's see, that'd be 70 to 74.
Okay.
And there wasn't much research going on at that school, but the University of Mississippi Medical Center was just a hop, skip, and jump away, and I got involved in research there, and that was kind of a beginning for me.
So you did your undergrad degree in business.
Yeah, and psychology.
And okay, I didn't hear that. Okay, and then you took a job or did you go to school again?
No, that was basically a collaborative internship. So I just did like a internship over there at the medical center.
And what were you studying, or what were you doing?
At the time, I did a biofeedback study about reducing stress. Yeah.
Okay, and somewhere along the way, you must have gone back and did some more graduate work somewhere.
Yep. Yeah, I moved to Nashville for a couple of years just to live life after school.
And play the drums.
And play the drums. Nashville, a lot of music there.
Yeah, that's what I thought. So you had your own band?
No, I just played with other people.
Other
people.
Okay.
And then I went to graduate school in clinical psychology at what was then Memphis State University, now University of Memphis.
Okay. And was that a program where you went straight through to the Ph.D.?
Yeah. Basically, I was there 4 years, and it was there I took a turn from mental health to physical health. The field of health psychology and behavioral medicine were just starting, and I said, I think I'll do this.
Yeah, that'd be pretty interesting.
Yes.
And so that was time period, late 70s?
Late 70s,
Yeah.
Right. And so in clinical psychology, you do a clinical internship. I did that at Brown University in Rhode Island,
Nice.
Went up north, lived for the first time, and basically stayed there a year.
Okay. Now, were you on faculty there, or what?
No, it's a training. It's an internship.
So it's sort
training.
of like a fellowship,
Yep.
or yeah, okay.
That's right. It's a requirement for the degree.
So that's part of it.
Yeah.
Yeah, you've got to go do that, and okay. So you're a trained clinical psychologist, basically.
Yes.
Okay.
Yes.
Okay. Do you know Ron Smith at Washington?
No.
Clinical Psych?
No, I don't.
Because he's done a lot of research with, or work actually with professional sport teams.
Okay, right.
So,
Right.
okay, so you're at Brown. What's the next stop?
Well, I decided I wanted to get more into prevention. So I did a postdoctoral fellowship at Stanford. And they were, at the time, doing the Stanford 5-City Project in collaboration with other heart disease prevention projects in Rhode Island and in Minnesota. So I wanted to work at the community level, which of course I was not taught to do in clinical psychology.
Right.
You focused on individual. So I went there, and the other reason I went there is I wanted to get into physical activity. I thought, well, so this is the very early 80s, and so you think about Paffenbarger's, some of his first studies came out in the late 70s.
Good point.
It was kind of the beginning of the fitness boom, and
tying it into public health a little bit.
Yes, yes.
Yeah.
And so everybody's awareness of physical activity and exercise was increasing, and I said, well, this is really interesting. It's a behavior. It's something, as a psychologist, I know something about.
Yes.
And very few people were looking at it from a behavioral point of view. So I said, well, this seems like a really good area. I'm going to go to Stanford, where many of the leaders are. So I worked with Bill Haskell. Ralph Paffenbarger was there.
Hyman Lee came too, but I don't know if you
Later.
had gone later. Okay.
Later,
Yeah,
yes.
yeah.
And Steve Fortman, Jack Farquhar, Nathan Maccabee. It was a real powerhouse.
Good group.
Of behavioral scientists, physicians, exercise scientists, and so it was just a great place to start out and get connected with many things and many people that, of course, continue to this day.
The word connected reminds me then of my next question. Was it at that time that you heard about the American College of Sports Medicine? Or?
Yeah. Yes. Although I didn't go while I was at Stanford, but I heard about it. Yeah, of course, from Bill Haskell.
Yeah, he would have been involved.
I said, well, that sounds like an interesting organization. I'll put it on the future list.
And you were there 4 years?
No, 2 years.
2 years.
2 years. Yeah, 2-year postdoc, and and so I started using some of the data that they had there with the Stanford 5-City Project, writing a variety of papers, and getting started in the physical activity field. And one thing I got the opportunity to do that wouldn't have happened otherwise is I got invited to the first small conference on physical activity and public health.
Oh, wow.
That was held at the CDC round about probably 82.
So Ken Powell?
Yes, Ken Powell organized that.
I talked with him last year, and he talked about that.
Yes.
And it was clearly a landmark meeting.
No question, no question.
Real turning point.
The first, kind of the introduction of physical activity to the field of public health.
Yes.
And a journal supplement came out of that, and those became seminal papers and heavily cited, and one of the early foundations for the field.
Was Mike Pratt there then, or did he come after that?
No, he was later.
He was later. Yeah. Yeah. Oh wow. I I didn't realize that you were really in on the ground floor.
I was, and and it was only because of being at Stanford, where of course Bill and others were invited, and they were nice enough to invite me.
Yeah. Yeah. Next stop.
Yeah. Next stop. I really liked being on the West Coast there in the Bay Area, and I said, okay, I'm going to try to find a job on the West Coast and stay here. It's very nice. So next stop was San Diego. And that
Beautiful
was
place.
1983. I said, well, that seems like a good idea. Let's try that out. And now, this year, will be my 30th year in San Diego.
Very nice.
Right, right. So it's worked out
Been
very,
perfect.
very well. So I was actually brought there by a pediatrician, Phil Nader, who was new at UC San Diego. And I guess I was like part of his startup package, you know, to have a...
Oh, this is what I want.
Yeah, I need somebody,
I
a
see.
psychologist, to help me write grants on physical activity and nutrition.
Yeah.
So that's what I did. And we started getting grants, and so we worked on some very interesting projects there for a while. And but you know, it was all soft money. It was all grants.
yeah.
So which was great from the point of view of I didn't have any distractions. So I learned about grant writing. I wrote a lot of papers, made a lot of collaborations.
And you didn't have to teach, or
And
did you?
I didn't teach much.
Yeah,
I taught
a little
some.
bit.
Yeah,
Okay.
yep, I taught some, but not a lot of committee works and that sort of thing.
Mm-hmm.
So that was very good. It was like a very extended, intensive postdoc in a
Yeah,
way. You
yeah.
know, kind of protected from the usual academic things.
What department were you guys in? Or
This was
different
in-
departments or all together?
We were in the Department of Pediatrics,
I'll be
but
darned.
we collaborated with people outside of that. So we worked with families.
There are
and-
medical schools there then?
Yeah, medical school.
Yeah.
Right.
Okay.
Right.
Okay.
So the interesting thing about that is that I then applied for a faculty of, you know, a tenured faculty position at San Diego State. So after 6 years at UC San Diego, I went over to San Diego State, and in the psychology department, spent 22 years there, did a lot of work, and you know, kind of did most of my career there. And just in late 2011, I moved back over to UC San Diego.
Okay.
Yeah. But in another department, in family and preventive medicine.
I'll be darned. But
Yeah.
still doing the same basic,
Yeah. The same,
Research,
same basic
writing.
work. Yes.
Yeah.
The same basic track.
yeah.
And so going back to UC San Diego, the you know, kind of a key attraction for me was that they had built up a real strength of experts in physical activity.
True.
And
Good
other
point.
behavioral medicine.
So you had colleagues there that you could work with? And,
Yeah, a lot of them. So the,
Yeah.
you know, we're really trying to bring a lot of the physical activity strength together and make something bigger. So that's something we're just working on now.
So at San Diego State,
Yes,
you were in which department?
psychology.
Okay. And did you have more teaching then?
Yes, yep. I taught
Undergrads?
taught
grads?
undergrad health psychology, and you know, from that wound up writing a health psychology book, textbook co-writing, and also taught doctoral students. Turns out we have a fantastic clinical psychology doctoral program there, jointly between San Diego State and UC San Diego.
Wow.
And it's you know, you bring together a medical school, a full-scale university, both of which have lots of research active faculty. It's a real powerhouse.
And attract good students too.
We attract excellent students,
Yeah.
and rated year after year as one of the top 2 clinical psychology
Wow,
programs in the country.
fantastic.
Right. So,
So
that's been good.
So you've had several doctoral students then, I
Yes.
assume?
Yes. Yes. Yeah. Had a number of doctoral students, a few postdocs, and that's been great.
Have they been introduced to ACSM, Jim, or not?
Some of them, you know, not
Would depend
not
whether
so
they're
much.
going the physical activity route, I guess.
Yeah, probably all of my graduate students and postdocs have come to ACSM. Maybe not all have joined or continued, but you know, because some of them have gone into broader areas,
Sure.
and but you know, some have stayed and some have not.
What's the sort of the tenor of the times now as far as psychology in, I would say, high-level athletics, i.e. bigger colleges and pros? Do a lot of teams have team psychologists? Maybe that's too far out of your
Yeah, I
field.
don't.
I was
I
always
don't really
curious.
know. I don't really know. But from what I hear, uh, there is a paucity of jobs for sports psychologists, and a lot of young kids are interested in it because it seems glamorous,
Yeah,
and they get to hang out with athletes,
Yeah.
and they get to help them with their performance. But what I hear over and over again is there are precious few jobs. And probably most pro teams would have a psychologist, but most college teams, I would guess,
Would
do not.
Yeah. So I've seen you give a lot of talks over the years, and if I remember correctly, you were talking a lot about access to physical activity in cities. And,
Yes, yes.
And could you comment a little bit about your research and what you've found? And I mean, it's one thing to say be active, but,
Sure.
but if you can't cross the street,
Yes, yes.
What are you going to do?
Yeah, well, maybe it would help to give my little personal evolution in this.
That would be great.
Because as psychologists, we're of course taught that people are in charge of their behavior, and we help them learn better ways of taking charge of their behavior, and to learn behavior change skills, to change their thinking, to get social support and all that sort of thing. So I dutifully started working on developing intervention strategies. Like when I was at UC San Diego for the first time, we worked with families to teach them to support each other, set family goals, work together. And we've worked in schools, universities, healthcare settings, and even work sites a little bit. And trying to access people and teach them how to be more effective in being active. And I have to say that we had some successes and a lot of what I would consider failures, putting a lot of effort into getting people motivated and educated about being active, and then not seeing much change come out of it, or the change that does happen being short-lived.
Yeah.
And so I had my own epiphany was early in my days at San Diego. We were working with these low-income families, and designing a program for them and recruiting them through school. So I said, well, let's take a look at the neighborhoods around these schools where these families are living.
Yeah.
And we were dealing with nutrition and activity. And so when we walked around, drove around the neighborhoods, low-income neighborhoods mainly, we said, well, maybe they have parks, but they're not really that nice. I don't know.
Or safe.
Or safe. I don't know if I'd want my kid, playing there without a lot of supervision.
Yeah.
A lot of the streets didn't have sidewalks, or if they did have sidewalks, they weren't very good, or the street crossings were pretty sketchy. Again, you might not want your kid, walking or biking around there. And then we looked at the food sources, and we found we were asking questions like, well, where's the supermarkets? And there weren't any.
Yeah.
So
no fruits or...
No, exactly. So where were people buying their food? Convenience stores, liquor stores, really tiny grocery stores.
Yeah.
So we had a list of like 75 foods that were the types of things that we'd be recommending. Fresh fruits and vegetables, low-fat products, low salt.
And they're not available, probably.
And we would go into these stores, and they'd have like 5 of them, And if they had fruits, the oranges were brown. The lettuce was brown. And we said, well, gee, how is this program going to work when we're encouraging people to go out and eat healthy foods and get their kids active, but it's unsafe for the kids to play outside, and they don't even have the foods. So in fact, this big grant that we had didn't really have many changes. And that was a wake-up call for me.
Good.
I said, it's a waste of time motivating people to be active.
They can't follow through.
Yeah, when their environment completely prevents them from acting on those motivations. So that really started me on a long path to say, well, let's think about the environment. Let's study the environment. Let's see if we can make change in that. And of course, since I had no training in it, it was a long process of figuring out how to do that.
Excuse me, but not many people are thinking this at the time.
Not many.
That's what I would think.
No,
Yeah.
not in the physical activity field.
Yeah,
No,
okay.
no. So I would put a few questions in surveys, and we would do a few things about the environment, and then about 1995, I took a sabbatical in Australia, and I said, all right, now I'm going to get serious. I'm going to get serious about the environment. I'm going to write a grant to measure and change the environment. So that was a school-based program, and we wanted we'd done other school-based programs. In fact, our Spark program, we did a grant there. That was the first grant I did at San Diego State, and we developed a physical education program that we saw as a health-related one that included a behavior change component, a classroom behavior change component. And so the short story there is it was pretty effective. We showed that it improved we could improve the quality of the instruction, how active kids were in class, fitness levels, some evidence of academic achievement improvement, sports skills, a whole range of outcomes.
Or junior
Elementary.
higher? Oh, elementary.
Elementary.
Wow.
Right. And so now that program is being used all over the country.
What
We're
does SPARK
disseminating it.
stand for?
Stands for Sports, Play, and Active Recreation for Kids.
Oh, very neat.
Yeah.
Who funded that research, that study?
That was an NIH study.
NIH,
Yep,
good,
National Heart, Lung, and Blood
good,
Institute.
Good.
And so building on that, we wanted to say, well, what if we just change the environment of the school? Don't go into the classrooms at all. Just provide more opportunities for activity. Try to improve the school foods, all the foods on campus, including those that are brought from home. And we'll try to intervene before school, after lunch,
vending
after school.
machines would be
Vending
part of it?
machines. This was middle schools, and they didn't have
No, they
vending
didn't have them.
machines for the
Okay.
students. They did
Okay.
for the faculty.
Okay. That's another issue.
Yeah, that wasn't one of our outcomes. So it was a total environment and policy intervention, and I started with schools because you can kind of define schools, and
Yeah.
it's easier to get your head around.
Yeah.
And we found that we did improve activity throughout the school day. And it was all based on observations, and we improved the total activity generated at school. So we thought that's very good. We had less success with the nutrition. But then I was ready to think a little more broadly.
And that was 95, you said,
That
right? Or-
that grant was 96 to 2000.
Okay.
Yeah, so I basically wrote it on sabbatical, and then
Okay.
and then we did that.
Okay.
And that is contributing, the middle school physical education and the after school activity kind of curriculum or manual are now being disseminated as well. So that's out there affecting way more than
Yeah,
a million
that's
kids
great.
every day. So that's been I think most researchers dream that you actually develop something, you test it, and then you get it used to actually
works.
better society. And it
Yeah,
works.
yeah, that's-
that's the key. of getting it
Sometimes
works.
unusual, isn't it?
It is. That's why I was frustrated that just working with individuals was not moving the bar.
So you
enough.
were saying then that led to something
Yeah,
bigger?
I was ready to think about the whole community. And so I was, we were starting to make collaborations and make connections with people in the planning profession. And they helped us think, we assess communities, and we think about walkable communities that are designed so that people can walk from their house to other places that they want to go, whether that's school or shopping or even their job. Whereas most of the construction in the U.S. in the past 50 years has been on the other side, unwalkable.
Yeah.
You separate the houses here, the shopping there, the jobs and office parks over here, and you're essentially required to drive from place to place. So we said, well, that seems highly relevant to physical activity, and one of the ways that we've probably built in reductions in physical activity. So let's study that. So we got a grant to study that. I'm sure it was the first grant of its kind to study, urban design from NIH. So we got that in 2001, and so that started really a whole series. That was a total shift in my career to looking at the built environment. Because we figured if you get the built environment right, it's going to affect a lot of people over a long time. If you get it wrong, it's gonna be a real barrier to everybody being active.
I see what I said. The time just flew by. I have one other question. So, like I said, I've seen you presenting here a lot at ACSM. Are there other venues, Jim, that you're also working in and getting the word out other than ACSM?
Oh, absolutely, absolutely. I've been coming to ACSM since 1984. And it's been very welcoming. People, I was one of the, when I first started coming, very few psychologists or behavioral scientists were doing that, but I've been encouraged by many presidents, and it's been a really good part of my professional experience. But at the same time, I've gone almost virtually every year to the Society of Behavioral Medicine, which is broader view of health and mostly behavioral scientists, a lot of physicians. And as time has gone on, I've gone to many other meetings, and by getting involved in the built environment, I've gone to American Planning Association meetings, Transportation Research Board. I've gone to landscape architecture meetings, and so we're
they need your input.
Yes. We're definitely getting the word out to a lot of other groups, and that's just the research groups. And then there's the practice groups and the policymakers, and we're very active in trying to educate policymakers about the impact of their decisions outside of the health field on the health of people.
Isn't it great doing the right thing at the right time? I mean, you're right there.
Yes,
At least we think
amazing.
it's the right thing.
We think so, yeah. I'm pretty convinced that we're on the right track now.
Well, thanks so much, Jim. I appreciate it.
Okay, my pleasure, Jack.
It went great, and